Hi everyone, I'm Bianca.
And I'm Libby.
And I'm Jordan, and we're swinging into OT.
So today we have a special guest, of course, as you know, Jordan. Jordan is a Sacred Heart University class of 2019 OT graduate, and he is currently an OT in the field, of course, in the middle of this pandemic. So we thought it would be pretty cool to see what he's kind of been through with this as a new OT and any changes, and then we'll just ask him some questions. But Jordan, if you want to go ahead and just give us a little bit of heads up of like about yourself, how it's been going so far.
Yeah. So, like Bianca just said, I'm a new OT. I'm about coming up on 1 year. In August, it'll be 1 year of working. Um, and so I've been in the acute care field now. It's been over a year because when I started this, I was in my last fieldwork placement. So I was at my job now for fieldwork. And then once fieldwork wrapped up, I ended up getting a job. They had an available position. So it's been over a year that I've been at this place, coming up on a year now of working there actually. And it's been wild. Acute care is hectic. Acute care is fast paced. And with everything going on right now with COVID, we're even getting pushed to new limits.
Awesome. So how exactly was the transition like? Like, how do your fieldwork experiences and your like new experiences as a new grad now coming on your full year, like compare?
So I had a really difficult first fieldwork placement. And so going into my second fieldwork placement at the hospital, I was really nervous because the first one was really difficult for me. But I asked so many questions. I went in ready to learn so much because I had never been in a hospital before. And thankfully, I loved it. Like as soon as I started working, I fell in love. I was on a neurology unit and had an ICU to take care of also. So I was seeing some pretty intense stuff right away. And I had a great supervisor who loved what he does, has had multiple students before, so he knew what to do with students. And so by the time I finished my 12 weeks of fieldwork, I was basically working full time. Like I had a full caseload. I was working with my PT coworkers as if I was an employee there. And so thankfully for me, the transition into work was pretty seamless, other than the time in between to study for the boards and take the test and get licensed. Um, but once I started back, it was the same faces, the same people I had just been working with for 3 months, except now I was getting paid for it. So it was a little extra benefit. But now, a year later, I mean, I read back some of my notes and some of the stuff I did last year as a student, and I've seen so much growth in just a year, because it's a really hands-on field, a really hands-on kind of job. So there's so much learning going on every single day. So I've really seen in just 1 year a lot of growth happening already.
That's awesome.
Did you end up taking like doing a temporary license, or did you work per diem for a while before like landing in your current job?
So I actually did work on a temporary license, only because I knew that the position I now have was going to be available for me. So while I was studying for the boards, I did start working because they had told me once you pass your boards, you can have the full-time position. So it was a part-time role when I first started under a temporary license, and that was just kind of the transition until I officially had my license and could start full-time.
That's awesome.
Really cool. Did you find it difficult to study when you were under temporary at all?
Yeah, yeah, and I had a lot of people tell me both ways, don't do it and to try it. Um, and for me, the biggest difference was that I needed something to do at least part of the week because I didn't have the mind to sit in front of a book for 40 hours a week. And so I split my days up. I was only doing 2 days a week of work. So it really wasn't that intense amount of work, but at least gave me something to split my week up with my studying habits. But it wasn't easy, and I definitely did study for a good while, probably a little longer than I would have if I didn't just go straight into taking the test.
That's awesome though. So now back to COVID a little bit, this crazy time. How has the world of OT changed during COVID in your current setting?
So, like I said early on, acute care is very hectic, very fast paced, rapidly changing schedule every day to begin with. And then once we got hit with this COVID, um, it has pushed all of us to be comfortable with even like faster pace and even more change than we're used to. And so what was what happened at first was kind of weird while we were waiting for this to hit in the hospitals. Hospitals kind of emptied out. I think people were getting nervous for a while of coming to the hospital just because of the fear of maybe getting it while you're in the hospital. So we were pretty empty for a while, which was weird because we were waiting for it. And then the influx of cases did come to the hospital. And so we had to revamp the whole hospital. We had extra ICUs converted to COVID only ICUs. We had 2 units in the hospital that had previously been for just like general medicine patients, transitioned to COVID units. And so at our peak, again, just at my hospital specifically, at our peak, we were pretty busy every day with this. Thankfully now it has really slowed down in our hospital. And so we've closed 2 of those units and we're down just to 1 regular floor unit for the COVID patients. But early on, the first issue was the PPE, figuring out what equipment we had, who was going to use it, how was it getting delegated. And then once that was resolved and we knew we had enough PPE available for everybody in the hospital, it was what was therapy's role going to be, because doctors didn't know if they should be consulting us, if they should be waiting until someone was not ICU level. And so early on, it was a lot of conversations with, because it was new to everyone, no one really knew what to do. It was a lot of conversations with the doctors in terms of what can we provide to these patients, even ICU level. Because I think a lot of people don't realize how much therapy does, even in the ICU. And with this coronavirus, what we're seeing a lot of the time is ICU stays are lasting 3, 4, 5 weeks. And so it's not just the physical deconditioning that you see from being in bed for that long. It's a cognitive aspect of it, of someone who comes in and maybe they're not totally aware of what's going on for 3 or 4 weeks. And then they have to come to the fact that now it's a month later than when they came into the hospital originally, or a lot has changed around them in the past 6 weeks that they've been in the hospital. So we were able to both, because I work alongside with physical therapists hand in hand all day. So OT and PT were able to go to doctors and kind of talk about rehab's role, both in the ICU and then once they came to the floors, how we could help them. And then I would say pretty early on, I think we were seeing about like 80 to 90% of the cases that were coming into the hospital. So almost everyone was getting a consult for OT and PT, at least to check in. Some people who had mild cases who just really needed like a day or 2 of monitoring were okay. But then some of the people who stayed with us for 4, 5, 6 weeks at a time, we ended up kind of being rehab because it was difficult to get people into rehab facilities. It was difficult to get people home with all of the isolation rules and all that kind of stuff. So we ended up doing a lot of rehab with people early on because they were kind of in the hospital with nowhere to go. So that, it early on, it was kind of a little chaotic because we didn't know what was going on, what we were going to do, if we were going to be consulted or not. Now it's just part of our everyday routine. And so, like I said, we're down to 1 unit. Thankfully, we have the capability to go back to 2 or 3 in the split second if we needed to. But it's been different. And I think one of the cool parts is seeing us get used to it and more comfortable with it. And so early on, like PPE, like I said, was a big topic. And so did we have enough gowns? Did we have the N95s or the respirators that we needed? Now, hospital wide, where we have PAPRs available, and those have been amazing for us. And they kind of look like astronaut little suits that we get to wear, and you wear a whole hood over your head, but it gets to filter out the air. It's a lot less restrictive. You can wear them for 6, 8 hours a shift.
Mm-hmm.
And so it's allowed us to be able to stay on the units longer, work longer with people because we're more comfortable. We can, physically we're feeling better. It was tough being in an N95 for an entire shift. And having to physically help someone up out of bed or physically move someone because it was difficult for us to breathe wearing those masks. But now with the new PPE we have, with the new, resources available in the hospital, as we're getting more comfortable with it, we're able to do a lot more with the patients.
And I
Did
think,
you end up having, oh, sorry.
go ahead, Libby.
Did you end up having to change how you would go about doing a treatment session with like all new restrictions and everything, or was it pretty much the same?
No, it was pretty much the same. The same struggles that we always had of convincing people they had to get up out of bed even though they felt crummy, that they needed to move, that they needed to work with us. Those all still existed. But really, more what you were seeing was a lot of deconditioning really quickly. And so people who were physically fit, active prior to this, just all of a sudden not being able to tolerate much. And so our treatments had to be really tailored to how much can you tolerate today? And we're just going to do what you can do today, and we'll see you again tomorrow. And tomorrow it may be a whole new day. But that was probably the only change that we were seeing. Otherwise, I mean, we're still doing everything we normally do with them.
Awesome. Wow. Thank you.
Yeah. Do you just to clarify for everybody, do you just want to maybe mention those quick occupations that you worked on with them?
Yeah. So in the hospital, it's kind of tough to look at some of like the areas of occupation that you learn about in school in terms of like play and leisure and that kind of stuff, because we're really doing like the essentials, like the getting up out of bed, the transferring out of bed to chairs, that kind of stuff. So we're doing a lot of balance. We're doing a lot of bed mobility work, doing a lot of standing activity tolerance. And then once we can get them up and walking, and this is hospital-wise, not even just the COVID patients, but we were seeing it with the COVID patients because such minimal activity cause them to lose their breath so quickly and fatigue so quickly. So it was a lot of sitting balance, a lot of can you do basic ADLs, brushing your teeth, washing up at bedside. Let's just start today sitting up and brushing your teeth. And then the first time we stood and the first time we took steps and that kind of stuff kind of took a few days with people. But I mean, I saw people, this is what I was saying was interesting. People were staying so long that I saw people early on where we were just sitting up at the side of the bed to the point where they were walking around their room taking care of themselves by the time they were ready to leave. So we ended up doing a lot more like rehab stuff than we're used to doing in the hospital. So it's a lot of just basic ADLs. And then in terms of cognition, it's just a lot of reorienting to what's going on, a lot of support, because it's a lot of people who can't see family members for weeks on weeks on weeks, who might be a little depressed, might be very anxious about their condition. And so providing some kind of just psychological stimulation and activity. And we put together like packets of word searches and crossword puzzles and all that kind of stuff, because unfortunately in these rooms, a lot of patients just end up sitting there alone for a lot of the day, unless it's like an emergency and a nurse needs to come in or a doctor needs to see them, because it's not easy to just go in and out of these rooms. And so they're spending a lot of time by themselves. Now we've gotten the capability of FaceTiming and Zoom meetings with family members and giving them that kind of, activity during their day.
That's awesome though. That's also must be like a really cool change in that setting to be able to see a client go fully from one end of the spectrum to a complete other end.
Yeah, it's not something typical. I mean, on a regular, before all this, if I saw someone twice, it was a big deal. Like usually it's just 2 or 3 days. You're hoping they're out into a rehab center by the time you come back for that second visit. And so seeing someone 5, 6, 7 times was pretty different, but it was really cool to get to see their progress.
Awesome.
So we're at about 14 minutes in. So I think, is it okay if we skip to the last question? What do you think, Bianca?
Go for it.
So what advice would you give to a fieldwork student or a new graduate applying for jobs in acute care?
I would say don't be scared, don't be afraid to do it, because I was so nervous going into a hospital, and I think that initial fear of the lines and the tubes and the drains and am I going to hurt someone, it's all normal and it's stuff that you have to definitely pay attention to. You have to learn what to do. But I would definitely look for jobs that have good mentorship, or ask about what kind of support that you do have. I work alongside with my PTs hand in hand. I mean, every day I learn as much as from my PT coworkers as I do from my OT coworkers. And so I think that was the biggest comfort for me, knowing that I could go treat by myself and feel comfortable at it by now. But early on, I knew if I needed a second hand in a room with someone, that there was always someone available. And so I think that might be a little comforting, knowing that in the hospital, you do have the help of other OTs or PTs or techs. You're not truly by yourself, really. So that would probably be the only thing I could think of, other than just go for it. I mean, it's a rewarding job. You get to help people really when they're at their lowest. And so you get to see them like perk up at the simplest things of getting up out of bed today, having a meal, being able to brush their teeth, that kind of stuff, where I think it's kind of unique to the acute care role.
Awesome. Thank you so much.
Well, that's cool.
Yeah, you're welcome.
Thank you so much again, Jordan, for being our first special guest on our little YouTube channel that we're attempting to do.
Yeah, this is fun. I'm happy to see this. I'm sorry this is what you guys have to be doing right now, but it's good to see that you guys are staying involved and staying active.
Yeah, definitely. And it's really awesome to hear your experience so far with all of this. We're glad that you're healthy, and we hope that everyone you work with is still healthy.
Taking care of each other. Just glad to hear that you guys are doing that.
Yeah, for sure. We're definitely great support systems for each other through all of this.
That's really awesome. Well, thank you so much, Jordan.
If you guys have a comment, please comment below about other things that you guys want to see, and also subscribe to us. We're trying to start this up. All right, we'll see you later.
Bye, everyone.
Bye.